Hello everybody, my name is Iriarte. Welcome to my YouTube channel. I'm going to talk now about the medial nerve and its ultrasound exploration. Nerves are very important to understand and its anatomy is mandatory because with new transducers we have improved a lot of knowledge about its exploration by ultrasound. And now we can see even very small branches, less than 1 millimeter width. So we need to understand all the anatomy of all the exhaustive anatomy of these nerves. And we are going to start with the median nerve. The median nerve burns in the brachial plexus and it has a participation of all the roots from C5 to T1. The lateral and medial trunks join and form the median nerve. The median nerve will be located with a close relationship with the axillary artery, and at the axilla we can find the nerve superficial and below above this artery. In the arm it goes medial always with the artery, but now the axillary artery is called brachial artery. Its location is between the biceps brachii and the brachial muscle, and it comes along all the medial side of the arm till it reaches the elbow. Proximal to the elbow, sometimes there's in 1% of the patients we will find a supracondylar spur located here, and sometimes with a ligament joining this spur to the medial epicondyle. This is the Strather's ligament. And when present, the nerve with the artery pass underneath this structure, and it may be a potential location of problems here. Always check this area if the patient has symptomatology. Okay, and now we are going to see with ultrasound all these structures. First of all, when I check the nerves of the upper limb, I always start with the same point because it's very easy to locate this point in all the patients, and I recommend you to know this plane in the upper limb. It's very important for me, and this plane without doubts is this one at the joint of the elbow. So I recommend you to place the probe in the anterior side of the elbow, and here you can see this image. And we can notice the distal humerus here with the lateral epicondyle with this round shape and the medial epicondyle with this V shape. Okay? There are three muscles here we need to locate. First one is this triangular shaped muscle, which is the brachialis muscle. Maybe you think this is the biceps, but here the biceps, we are too distal. The muscle is here, and this is a tendon of the biceps here. There's no biceps muscle here, only brachii. Okay, in the medial side, there's the Pronator teres here, and between the brachial muscle and the Pronator teres, we will notice this hyperechoic area, which is this fascial plane between the Pronator teres and brachial muscle, and inside we will find the median nerve, always. Okay, very close to the brachial artery here. This is a normal variant with two arteries, but usually we will only find one. Okay, this is the medial side, and in the lateral side between the brachial and this muscle, which is the brachioradialis muscle, there's another hyperechoic plane, fascial plane, and inside you will find the radial nerve. The radial nerve, if we are properly located, is beginning to divide into several branches here, usually 2 or 3. There are always 2, the superficial and the deep branch, and this is a third one, which is the branch to the brachioradialis muscle. If we have this image and we go proximal, we will notice the 3 branches joining in one nerve, the radial nerve. Okay, perfect. This is the biceps tendon, the biceps brachii tendon, and that's all I want to show you in this image here. Very important. Once we have located in this image the median nerve, we are going to follow following it proximal. Okay, let's go and see what it happens. If we are assessing the nerves of the upper limb, I usually recommend to place the patient seated in front of you and ask the patient to bend to the lateral side and to explore the median nerve. If it's very important to check the axilla, then we need to ask the patient to lie supine and with abduction of the arm. But this position is not very comfortable to explore the wrist or the forearm. So if the elbow, forearm and wrist and hand are the most important areas, I usually ask the patient to be seated in front of me. Once we have located the first position here, then we are going to go proximal, and we will notice here the biceps, the brachial muscle. This is the biceps. You can see it's this intramuscular tendon here, and this is the brachialis muscle. This is the brachial artery, and this is the median nerve located here. Now, if we go proximal, then the brachialis muscle will disappear, and the triceps muscle will appear. This is the biceps, this is the triceps muscle, and this is, I don't know, perhaps this is the origin of the brachialis muscle, surely, because we are too proximal, okay? And this is the axillary artery, and this is the median nerve located in the top of the artery here, superficial. Okay, let's go, and we are going to see now with a video how the nerve goes proximal. We start here at the elbow. Here, this is the median nerve. We go proximal. This is the brachialis muscle. Notice brachialis muscle, tendon of the biceps. Then, as we go proximal, the muscle of the biceps brachii appears here. This is the brachial muscle. This is the biceps muscle. This is the brachial artery and the nerve here. This is the triceps muscle, and this is the beginning of the brachialis muscle. Okay, always the median nerve with the artery. And as we go proximal, notice the position of the nerve superficial to the artery. Now we have the axillary artery here. We are at the axilla here. Okay, and this is the median nerve located superficial. Okay, understood? Okay, let's continue to the next area. The elbow is very important in the median nerve because it has several locations that may compress the nerve. So a very accurate understanding of the anatomy is mandatory. Okay. Once we have passed the arm, in the elbow, the nerve is medial to the artery and medial to the tendon. So we will find the nerve, artery, tendon disposition, location. Okay. Then the nerve goes into the cubital fossa and passes beneath this structure here. This is the bicipital aponeurotic expansion of the biceps brachii, okay, or also called lacertus fibrosus. And this is maybe another potential compressing location of the nerve. Okay, let's take a look in the axial plane. This is the biceps tendon, this is the brachialis muscle, this is the pronator teres muscle, and this is the lacertus fibrosus. Here the brachial artery, and here the median nerve. If we have a look with ultrasound at this area, is the same plane we have just checked, again with the brachial artery, with this variant of two arteries, biceps tendon, brachialis muscle, pronator teres, median nerve, and this thin structure superficial to all these vessels and nerves is the lacertus fibrosus, which reaches the antebrachialis fascia here. So always check this area. Okay. Now another important structure, the pronator teres. The pronator teres has two heads, a superficial and a deep one. The superficial burns in the medial epicondyle and the deep one burns in the cubitus. And the medial nerve has a bad idea to go through these two heads. So this is another potential location of injuries of compression of the nerve between the two heads of the pronator teres. If we locate the nerve at the elbow and go distal, we will notice the pronator teres muscle, its superficial head, and below the deep head, usually small and sometimes very difficult to see. Sometimes we even cannot see this area. And very curious, the artery goes beneath this deep muscle, this deep head, and the nerve above. So the deep head passes between the artery and the nerve, medial nerve, brachial artery. Okay, this helps us to distinguish this deep muscle. Let's go with a video. We start at the elbow, at the tendon, nerve, artery, tendon, nerve, artery, tendon, okay? And we are going to follow the medial nerve distally. Pronator teres, and between the artery and the nerve, here we can see the deep head of the pronator teres here. Always check this area. Okay, let's continue. Once we have passed the pronator teres, then the flexor digitorum superficialis is the next target. This muscle has also two origins, in the medial epicondyle and in the radius. And between these two origins, there's a fibrous structure called the sublimis bridge. And again, the nerve can have may have problems at this level. The nerve goes deep to the flexor digitorum superficialis and superficial to the flexor digitorum profundus. Between these two muscles, between these two layers, okay? You can see here the flexor digitorum superficialis and the flexor digitorum profundus, and this is the median nerve. If we follow this plane between these two flexor digitorum superficialis and profundus, and we go cubital, we go medial, we will notice there's another nerve here with an artery. This is the cubital nerve. We will check it in another video, but just I want to show you that the cubital nerve is in the same plane at this level that the median nerve, between the flexor superficialis and flexor profundus. As you can see here in this image, if we follow the median nerve, a branch arises here. This branch goes deep between the flexor digitorum profundus and the flexor pollicis longus here. Okay, this is the anterior interosseous nerve, and this nerve goes deep and reaches the interosseous membrane here, and usually it's accompanied with an artery, the anterior interosseous artery. This is very thin branch of the nerve, and sometimes it's difficult to see, but we must seek this artery, and close to this artery we will find the nerve. This nerve innervates the flexor superficialis, the flexor pollicis longus, the pronator teres, and the lateral half of the flexor profundus, usually the component of the second and third fingers here. Okay, and as we go distal, it will innervate the pronator quadratus here. Usually remember that the median nerve is pronator and flexor. Okay, this is a simple rule to remember the muscles innervated by this tendon. Okay, and as we go distal, then we notice that the nerve goes superficial and will be even very close to the skin, between the palmaris longus tendon and the flexor carpus radialis tendon here. Just at the wrist is very, very superficial, so it's very dangerous to have an injury here because the nerve is very close to the skin. Okay, now we are going to check all these structures with the ultrasound, and we begin at the forearm, and between this flexor digitorum superficialis and flexor digitorum profundus, here we can find the median nerve. This is the flexor pollicis longus, and if we follow this plane between the superficialis and the profundus flexor digitorum muscles, we'll find an artery with a nerve. This is the cubital nerve and the cubital artery. Okay, perfect. And we can notice another artery here, very, very close, stuck to the interosseous membrane here, and this is the anterior interosseous artery, and the anterior interosseous nerve is here. It has already detached from the median nerve, has passed through these two muscles, and has arrived here to the interosseous membrane. This walk through these two muscles of the anterior interosseous nerve is very difficult to see because it's a very small nerve. This is deep, so it's very difficult to see. But here we can see usually the anterior interosseous artery. Okay. And finally, at the wrist, you can see here the pronator quadratus muscle. Okay, this is the palmaris longus tendon. This is the flexor carpus radialis tendon, and between these two tendons, the nerve very close to the skin at this level. And a video. We start here. This is the median nerve. This is the flexor digitorum superficialis. This is the flexor digitorum profundus. And you can see here the anterior interosseous nerve, which is searching the anterior interosseous membrane here. Okay, this is the nerve. This is the flexor pollicis longus, and the nerve located between these two planes of the flexor digitorum superficialis and flexor digitorum profundus. Okay, this is the flexor pollicis here. And if we follow this plane laterally, we are just going to see now here, between the flexor superficialis and flexor profundus, we will reach the cubital artery with the cubital nerve here. Okay, as we go distal, the nerve becomes superficial. This is the pronator quadratus, and is below the palmaris longus and the flexor carpus radialis here. Very, very subcutaneous here. And then it again becomes deep because here he will reach the tunnel, the carpal tunnel, sorry, as we are going to see just right now. Okay, carpal tunnel, very, very important. Which are the boundaries of the carpal tunnel, and which are the structures we must know to explore the carpal tunnel? First of all, the tunnel entrance. Lateral boundaries are the distal pole of the scaphoid sorry, and the pisiform bone. This is the beginning of the carpal tunnel here. And the roof is the transverse carpal ligament. Okay, very, very important. And the tunnel exit is formed by the amate hook, amet, I don't know the name in English, amate hook, okay, and the trapezium tubercle here. This is the end of the carpal tunnel. As you can see, it's narrower than the beginning of the tunnel, and here always notice that the nerve is in the superficial into these tunnels here, okay, and here. And the content of the tunnel are all the flexor tendons, the flexor pollicis longus, but the flexor carpus radialis is outside the tunnel. Okay. And with ultrasound, we must place the probe properly. So I recommend you to palpate the scaphoid distal pole here with your fingers and the pisiform bone here, and then put the probe over these two bones, and then you will have a good location of the beginning of the carpal tunnel with this image. This is the scaphoid, this is the pisiform, and here you can notice the flexor carpis radialis brevis, very anisotropic. This is the transverse carpal ligament, this is the median nerve, just superficial into this structure, and the flexor tendons inside the carpal tunnel. Notice this artery, this is the cubital artery, and this is the cubital nerve. If we go distal, then we'll notice again two bones, the amate hook and the tuberculum of the trapezoid bone. This is the transverse carpal ligament, and again the nerve superficial to this area. It's normal to have a worse view of these structures because distal tunnel is more difficult to see, and you need to adjust your probe settings and ask for 7 or 10 megahertz frequency, and usually go with more gain to have a good view of these areas. Okay, important. And there are two branches we need to know, two small branches, and now we need a good image, a good ultrasound machine with proper transducers. Here I'm using a 22 megahertz stick probe, which a very good quality of image. You can notice here the median nerve with its fascicles, and this small branch here is the palmar cutaneous branch, and it arises from the nerve proximal to the carpal tunnel. So this branch will not be affected in carpal tunnel syndrome. So the sensibility of the tenor eminence will be preserved. Okay. Usually this branch goes below the flexor carpis radialis tendon, because usually this branch it has a medial orientation. Sometimes it may be cubital, and maybe we will have problems in surgery if we don't know this thing before surgery. So it's very important to check for this small branch. Here you can notice this small branch here, searching the flexor carpis radialis tendon. Now this branch goes through the antebrachial fascia, just now here, and passes through this fascia and goes in the fat below the skin. Okay, so this is the palmar cutaneal branch. And there's another branch very important to know, which is the recurrent branch of the opponent muscles of the nerve. This is the recurrent branch. Okay, and this branch appears in bones just distal to the carpal tunnel here, and as you can notice goes with this orientation, with this direction, with this proximal direction. So to see this branch we must follow the nerve past the carpal tunnel. Now you can see here, okay, this is the final tunnel here. This is the hook of the amate. This is the cubital artery. This is the nerve, and the trapezius is here. Okay, here the tubercle of the trapezius. So we are in the final tunnel, and here you can notice, okay, this small branch which appears here and goes as we go. First I'm going distal, and once I notice this branch I go again proximal to follow this branch. Okay, so excuse me, the branch appears here, and now we are going proximal, okay, distal, proximal, and you can notice distal again and proximal. You can notice here the branch going into the muscles of the tenar eminence. Okay, very important, these small branches. Okay. What about motor innervation of the hand? I usually made my own rule to remember these muscles and this innervation, and I can tell you that all the hand muscles belong to the cubital nerve, except the tenar eminence. Okay? Okay. All the muscles of the tenar eminence belong to the median nerve, except the deep head of the flexor pollicis brevis, which belongs to the cubital nerve. Okay? And finally, the unique muscles that are not inside this rule are the lumbricals. Lumbricals, they share muscles. So the first and second lumbrical are belong to the median nerve, and the third and fourth belong to the cubital nerve. And that's all you need to know about the innervation of the motor innervation of the muscles of the hand. Okay? And finally, the sensory innervation is easier, and the first, second, third, and the radial side of the fourth fingers are innervated by the median nerve. The dorsal aspect of these fingers belong to the radial nerve, except the distal part of the second, third, and radial side of the fourth, which belong to the median nerve. Okay, and that was all. I hope you find it useful. It's difficult to explain such complicated structures in an easy manner, but I try. Okay, and just practice with your patients, with yourself, and try to find all these branches, all these structures, and you will find it very useful. Thank you very much. And remember, if you like the video, check the like, and don't forget to subscribe if you want to be informed about new releases. If you have any doubts, please leave a comment. See you!